my name is Danielle, and this is my reflection portion of the RN interview assignment. I just want to put this out there at first and say that I'll be referring to the RN that I interviewed for this assignment as Sarah. That's not her name, but just to respect her confidentiality, she will be Sarah for the purpose of this assignment. So I'm going to start by just talking about what the interview process was like on my end from the perspective of the interviewer. And I'll start by saying that it was interesting because I'm friends with Sarah outside of school or the nursing world, and so it was interesting having to change from a regular kind of friendship setting into an interview for the purpose of this assignment, and so just changing contexts. And I think that this really forced me to think about the assessment portion of the nursing process, actually, where it's all about how do you ask questions to elicit the information and collect the information that you need while still doing it in a way that's professional yet relational, where you're still building rapport with the clients, where you're not coming in too hard and being like, okay, this is the information I need, and doing it in a robotic kind of way, but still showing like you care, you're genuinely interested. But there are certain pieces of information that you need to collect. So that was interesting, and a lot of that I would say that I accomplished just through my nonverbals as I was there asking the questions and then listening to her answers and just showing that like I'm engaged. And even though it's hard, sometimes you're trying to type out their answers and still be like, yeah, okay, show that you are listening. But I tried really hard to just like communicate through eye contact, through just gestures to like show that I'm present in the conversation. And then another aspect of the interview which was interesting to navigate is that often she would say things that I found really interesting and that I wanted to dive further into. And so sometimes I would ask like another question, a follow-up question to something she said that piqued my interest, that would kind of start to lead us on a bit of a tangent. And I think in nursing, tangents are okay and sometimes actually necessary if a patient says something that you need to explore further because it's actually quite concerning or just noteworthy. And so I think it's important to learn how to navigate going on those tangents and getting further information, but also recognizing that time is of the essence. And even for this interview, I mean, there were so many things that I could have asked her more questions about, but I had to recognize, okay, we set the time limit for 30 to 45 minutes is what I told her, and so I didn't want it to go on for an hour or two just because I had asked a bunch of questions. And as far as the actual content of the interview itself, Sarah had a lot of insight to offer. She's been in the field for quite some time and has even been in an education type of role, so just lots of insight and experience to draw from. And I would say unknowingly she touched on so many different concepts from the course content. She mentioned confidentiality, interdisciplinary teamwork, competency, continuing education, professional responsibilities, ethical dilemmas, and when personal views contradict with patients' desires or plans of care, or even policies. So yeah, she mentioned all kinds of different things, and it was just quite a rich discussion. I would say there were two things that I found especially notable. First of all, it was just when she talked about her role and described what she did for a day in the life. It was just something that I didn't even know existed. She works primarily in an office, so not at all kind of the conventional understanding of nursing as far as being at the bedside and caring for a patient in that way. It's a lot of administrative type of work. She's in an office making phone calls, and essentially a huge part of her role is matching up transplant donors. So super interesting and kind of a niche area of nursing, which made me feel quite excited to just learn, okay, like, this is one example of a very unique facet of nursing, but I'm excited to learn about what other niche positions exist out there. So that was really interesting. And it's cool that it's all within the scope and under the umbrella of being an RN. Another aspect of the interview that I found really, really interesting was when Sarah shared a story of kind of an ethical dilemma that she faced, and within that ethical dilemma, she identified two contradicting policies that were impacting the patient's care that they were receiving, and she realized that one policy, if they followed it, would be detrimental to the patient's care, and another policy, if they followed it, would be very beneficial and would better suit the patient's requests and needs. And so she actually had to go to management and say, we need to follow this policy instead of this policy, and this is why. And when she was sharing this story, it showed me a few different characteristics that I think nurses should strive to be, and as a nursing student now, that I should strive to be developing while I'm in school. And so the first one I would say is just like knowledge, just knowing your stuff and being aware of those policies, because if she didn't know both of those policies, she wouldn't have been able to bring up this situation where they were contradicting each other and impacting the patient. Another thing I would say that I saw in this story was just a level of courage, because it's never easy to go to those in authority and to challenge the way that they might be doing things, or even just to challenge the system and how it's been structured for a long time. So I thought that that was very bold and assertive of her to do. And then another thing is just like taking on that role of being an advocate and just having enough care for the patient, that you're willing to do things that might be uncomfortable in order to best care for them. So those were really, really notable and interesting parts of the interview, and created a very interesting discussion. So moving forward in terms of how all of this has impacted my perception of nursing, I would say that if anything, this has just made me have a broader understanding of what is nursing and what does it mean to be an RN. And it makes me feel excited to look into future opportunities, especially because I'm actually also a social worker, and so just looking into what different roles could look like where I could incorporate both areas of expertise into. So yeah, I'm really excited about what opportunities might exist. And I also just really appreciate some of the things that Sarah said about keeping an open mind when you go into nursing, and understanding that it's okay to try different things and maybe not like them, and it's okay if you have to try a few different things before you find something that you really are passionate about and something that really sticks. So that helps ease some of the pressure. And then another thing that I really appreciate is what she said about the importance of collaborating with your colleagues, and how she encouraged me to start doing that while I'm in school, and to find people that I can work together with, and find your people that you can collaborate with. So that's about it. That's my reflection, and thank you for watching.